Hi friends, it's me again with another video. I cannot believe that in my last video, my first video, I forgot to mention the fact that my name is JT. So hello, I'm JT, and if you haven't watched my previous video, I am doing a research project for my Women's and Gender Studies class, where I will basically be hopefully educating a lot of people about the experience of what it's like to be trans. My last video was just broadly about what it's like to come out as trans. And this video is going to focus more on gender dysphoria. So I have a lot of different topics to talk about in relation to gender dysphoria, and I do feel like this might be a little bit of a longer video just because I do feel that understanding gender dysphoria is really important for understanding trans identities. So let's go ahead and get started. So first and foremost, I do want to start by explaining what gender dysphoria is, but before I get there, I actually do want to explain what my definition of gender is and what is accepted by most psychiatrists, psychologists in the field. So a lot of people tend to conflate the ideas of gender and sex, but the two concepts are actually not interchangeable. So sex refers more to your biology, the chromosomes, what the doctor assigned you at birth, and your gender is all of the social aspects of the way that you present yourself. And those tend to fall into two main categories, which is masculine and feminine. A lot of people that are assigned female at birth tend to have more feminine characteristics, so their gender would be a woman, and the opposite for men, right? I feel like this is important for understanding gender dysphoria because under this ideology, you can change your gender. Of course, there's no way to biologically change your sex. You can definitely change your secondary sex characteristics, but you definitely can't change your chromosomes at this point in time. So I do just want to make that distinction. So I do want to make it clear that that is the pretty widely accepted definitions of gender and sex. And I'm pulling that directly from the DSM-5. If you're not sure what the DSM-5 is, it's the book that psychologists and doctors use to diagnose mental disorders and mental conditions. So now I really want to go over the criteria for gender dysphoria and what it really means to have gender dysphoria in the clinical sense. So I have it in front of me here. I am just going to read it off the iPad just because it is technical and I want to get it correct. So there's two categories, A and B, and this is starting with children. So how gender dysphoria tends to manifest in children. So A, a marked incongruence between one's experienced expressed gender and the assigned gender of at least 6 months duration as manifested by at least 6 of the following. Number 1, a strong desire to be of the other gender or an insistence that one is the other gender, or some alternative gender different from one's assigned gender. Number 2, in boys, a strong preference for cross-dressing or simulating female attire, or in girls, a strong preference for wearing only typical male clothing, and a strong resistance to the wearing of typical feminine clothing. Number 3, a strong preference for cross-gender roles in make-believe play or fantasy. Number 4, a strong preference for toys, games, or activities stereotypically used or engaged in by the other gender. Number 5, a strong preference for playmates of the other gender. Number 6, boys, a strong rejection of typically masculine toys, games, and activities, and a strong avoidance of rough and tumble play. Or in girls, a strong rejection of typically feminine toys, games, or activities. Number 7, a strong dislike of one's sexual anatomy. Number 8, a strong desire for the primary and or sex characteristics that match one's gender experience. And then this is the second category, B, for children. The condition is associated with clinical distress or impairment in social, school, or other important areas of functioning. So again, sorry, I know some of it's kind of technical, but now I'm going to go over the diagnostic criteria for adults. So category A marked incongruence between one's experience, expressed gender, and assigned gender of at least 6 months duration as manifested by at least 2 of the following. Number 1, a marked incongruence in one's experienced or expressed gender and primary and or secondary sex characteristics. Number 2, a strong desire to be rid of one's secondary or primary sex characteristics because of a marked incongruence with one's experienced or expressed gender. Number 3, a strong desire for the primary and or secondary sex characteristics of the other gender. Number 4, a strong desire to be of the other gender. Number 5, a strong desire to be treated as the other gender. Number 6, a strong conviction that one has the typical feelings and reactions of the other gender. And B, the category B for adults, the condition is associated with clinically significant distress or impairment in social, occupational, or other important areas of functioning. So again, I know that was kind of boring, and I'm sorry for that, but I do think that having the diagnostic criteria for gender dysphoria laid out right in front at the beginning of the video is really important, just for understanding the disorder in general. So the idea of kids being able to exhibit signs of gender dysphoria is actually pretty controversial at this moment, just because of everything that's going on in like the political state as of early 2025. But studies actually show that the symptoms or signs of gender dysphoria actually mostly show up in young childhood. So there was a study done by Zalizniak in 2021 that was a sample of 210 adults who identified as transgender, and they asked these adults when the symptoms of their gender dysphoria began to onset. And most participants actually said that it was around ages 3 to 7, so very young, and also about the same time that other kids start to get an understanding of their gender, even if they're not experiencing gender dysphoria. So a kid around 3 to 5 years old may start to understand that they're a boy or that they're a girl. And it's really the same for trans people, just they feel a disconnect between what they were assigned, their sex at birth, and their gender. So if a lot of kids are experiencing gender dysphoria this young, why are more people not diagnosed at such a young age? That's mainly because there's a lot of stigma. There's just a lot of people that don't really accept the idea that a kid could be experiencing gender dysphoria, or a parent would be a little bit embarrassed to take their kid to the doctor for experiencing something like this, especially if they have like religious or moral views that kind of go against the idea of gender dysphoria or transgender people in general. But another big aspect of it is that the severity level of your gender dysphoria can very much predict like how quickly it's going to be diagnosed in you. In general, people that have much more severe cases of gender dysphoria tend to have those diagnoses earlier in their life, just because they're very sure, right? They know that something's wrong, and they know exactly what is wrong. And so the process from there is basically just convincing their parent to take them to the doctor, and then the doctor gives them a diagnosis based off of their symptoms. These tend to be the more clear-cut cases in terms of both the patient knows what they're feeling, but also the clinician that is diagnosing this patient is going to have a clearer and better understanding of the fact that it's gender dysphoria that their client is facing. And Dr. Z, she has a channel here on YouTube, and I think the full title is Dr. Z PhD. She just has a lot of really good videos about gender dysphoria, trans identities in general, so I definitely suggest checking her out if you haven't. But she has a really good video about the different levels of gender dysphoria that people can feel. For more moderate cases, that's when it tends to manifest in different ways than it does for people with severe cases. So a person with moderate gender dysphoria might understand that they're experiencing some incongruence there with their sex and gender, but they don't fully understand that it's gender dysphoria, or it may manifest in depression or anxiety instead of gender dysphoria symptoms. And so that can be a little bit harder for the clinician to figure out if the client doesn't come into the office and say, well, I think I have gender dysphoria, or I feel like a girl and I was born a boy, that can't be right. So those cases tend to take a little bit longer with professionals to try and figure out what's going on. So I already referred to the fact that a lot of people experience gender dysphoria starting at the ages of 3 to 7, but that's definitely not the case for everybody. Some people reported really only feeling strongly about their gender dysphoria when it came time for them to hit puberty. There was a really good study in 2021 from Jessen, Harold, and Stanicky, and they also described the experience of people who didn't really feel gender dysphoria until the onset of puberty. And this is mainly hypothesized because you experience the development of your secondary sex characteristics for the most part during puberty. You might have breast growth, and just other different things that are assigned with your biological sex. So the next point I want to talk about is why a person may get a gender dysphoria diagnosis. And I think it boils down to two main reasons. First and foremost is that when you have the gender dysphoria diagnosis, you are much more easily able to access gender-affirming care to treat your gender dysphoria. And so you can do that under the supervision of doctors, get professional opinions, and make sure that you're taking the steps towards treatment that will be most effective and safe for you. And I think the second biggest reason is that having that diagnosis for a lot of people feels very validating, because they know that this identity may have been something that they've struggled with for a long time, but having a doctor reaffirm that, like, yeah, you're not crazy, like something's going on, and you have an official gender dysphoria diagnosis, that can help to validate a lot of people. So those are the reasons that I think that a person seeks out a gender dysphoria diagnosis. So how do you get diagnosed? I think most importantly, you must fit the diagnostic criteria for gender dysphoria. So whether you fall in the childhood or adult section, you have to fit into those diagnostic criteria that I listed earlier that were very technical. The actual process for going about getting that diagnosis can actually take quite a long time or quite a short time, depending on where you live. Whether that be if you're in the United States, it can really vary by state, or other countries in general have way different laws about trans identities. And so that's something you would definitely have to research regionally wherever you're at. But I know in some states, the process can take a lot longer. Some states require multiple referrals from multiple healthcare professionals or mental health professionals. And so you may have to see a therapist or multiple therapists long term in order to be able to get that gender dysphoria diagnosis. For me in Illinois, since it is a more liberal state, I did have a much easier time going about getting the diagnosis, and I think there were a lot more resources for me just to be able to get that diagnosis. But more liberal states tend to not draw out the process longer than it needs to be. So in my case, I saw my primary care provider, and I let them know that something was going on, and I thought that it might be gender dysphoria based on what I know. I study mental disorders, so I knew that that might be what I'm experiencing. And my doctor, who was a younger doctor, he said that he wasn't totally comfortable with the idea of diagnosing and prescribing those medications, and so he referred me to a specialist, which I'm very thankful for. So now I went to a gender equity clinic that I was referred to, and then I saw a doctor there who is a trans care specialist, and she is the one that diagnosed me with gender dysphoria after a pretty lengthy session where she questioned me and assessed my goals and whatnot, and then prescribed me stuff. For people that are in more conservative states, right now I definitely feel for you with the experience of a lot of anxiety around the idea that you may not have access to certain care in the future, or it just feels unstable right now, and I really do feel for you. I wish that all trans people could move to a place where they feel more validated, and that they don't have to worry about their standard of care being lower. So I think the piece of the entire story that most people are most interested in is what gender dysphoria actually feels like. Because for a lot of people, even if they don't have any sort of negative feelings about trans people, they still have no idea what it may feel like to not identify with the gender that you were assigned at birth, and that's kind of a foreign concept to them. So of course, like I talked about in my coming out video, a lot of the experiences that trans people go through are so individual, and everybody's individual journey is going to be so different. But I will still try to give some general stuff that a lot of trans people still will feel. So there are two really good YouTubers here on this platform. One is named Katie Morton, and the other is Jamie Dodger. Katie Morton is a licensed therapist, and Jamie Dodger is a person who has been transitioning for a long while and has their fair share of experiences with gender dysphoria. And so I want to pull from their experiences as well as my own about what gender dysphoria actually feels like. So most people describe it as a persistent discomfort that comes along with things related to gendered parts of your identity. And it can kind of feel like, Katie Morton put it, that it can kind of feel like a sadness or just a general discomfort or tension that never really goes away. and can be worsened when you're put in certain situations. On to how it actually manifests in your daily life. That same Justin article from 2021 that I mentioned earlier had a really good section in their paper about this. So they did a meta-analysis of about 12 different studies of qualitative experiences of trans people. And in all 12 studies, the one thing that was present was the idea that people who are experiencing gender dysphoria really feel a sort of othering, but to themselves, right? They may not feel like they fit in ever. And this, I remember for me personally, this goes back to the youngest kindergarten, 5 years old. I remember looking at the other kids and knowing something about me was different and that like I wasn't experiencing things the same way that they were. And obviously I was too young at the time to be able to put that into words. And it wasn't until way later that I figured out that it was gender dysphoria that I was feeling. But this navigating in the dark idea that Justin brings up is really prevalent among people that are experiencing gender dysphoria. In daily life, trans men tend to be dysphoric about the opposite things that trans women are dysphoric about. So for trans men, it may be they're dysphoric about the fact that they don't have facial hair, or that they don't have a penis, or that they have boobs, and they want to get rid of those. But it can also come down to even smaller stuff, like having smaller hands and smaller feet, or having softer skin. Those are things that are typically associated with being feminine. And so trans men may feel dysphoric about that, where, as I mentioned, on the other hand, trans women would have the exact opposite experience in most cases, where trans women may be dysphoric about the fact that they don't have any breast development, or they may be dysphoric about the fact that they do have a penis, or that their skin is rough, or that they have a lot of body hair, or stuff like that. When it comes to non-binary people, there's really no like set things or set typical things that they may be dysphoric about. It kind of just depends on the person, but they can have a mix of gender dysphoric feelings from both trans men and trans women. It's kind of like an amalgamation of the two types of dysphoria in a lot of ways. They may be more severe and maybe less severe, but it doesn't really follow a distinct pathway. One story from Jamie Dodger, who I mentioned earlier, that I really not enjoyed, that's not the right word, because it's kind of a sad story, but I thought it illustrated this topic well. Jamie describes the experience of being in school or being in class and deciding to basically socially withdraw, avoiding answering questions. If they felt like they had to say something, no, they didn't, that type of stuff. And it was simply because they really didn't like the sound of their voice. They thought that it sounded too feminine, and they wanted it to be deep, like all the other boys, and it wasn't. That's kind of a smaller example of how gender dysphoria can impact your day-to-day life, but it definitely goes for a lot more than your voice, right? That tension or uneasiness or discomfort comes along really anytime that you're reminded that you have an aspect that doesn't match your internal gender identity. For me, a trans woman, right, it may be that, every time I open my mouth to speak, my voice is deep, and I'm working on voice training, but that doesn't really diminish the fact that I feel dysphoria from the fact that my voice is deep. Same thing goes with appearance too, right? As humans, especially with phones that have cameras on them at all times, you're constantly seeing your own reflection. And so, anytime that I'm reminded that I look masculine in any way, that is dysphoria inducing. I think maybe we have it worse in the digital age because we see ourselves so much and there's just so many photos taken and everything. But people have been experiencing gender dysphoria for hundreds of thousands of years. So one important note is that gender dysphoria, it doesn't always spark from something internal, right? It can also come from the ways in which you interact with people, other people. That's kind of gets into the topic of like somebody misgendering you, whether that be intentional or on accident, but definitely the ways that people interact with you and view you as a man or a woman in society can affect your levels of gender dysphoria. Because I know that if every single person in my life viewed me as female, my dysphoria would be lessened quite a bit, because that is a large source of my dysphoria, is the social aspect of it. Unfortunately, sometimes it does go far past the sense of uneasiness or discomfort In some severe cases of gender dysphoria, suicidality and self-harm can be outcomes of having gender dysphoria that's untreated. And there was a study by Zucker in 2016 that found that 1 in 3 people who've been diagnosed with gender dysphoria report having some form of either a suicide attempt, non-suicidal self-harming, or any sort of suicidal ideation. So those are pretty upsetting numbers. So it kind of shows the severe impact that gender dysphoria can have on the mental health of some individuals, especially when it's not treated. So how do you go about treating it? Again, every single person's gender transition is going to be completely unique. But there are some kind of set ways that people tend to treat it or transition, and so I'll go through those now. So while everybody's experience with gender transition is different, there is a scientific and psychological consensus that really the only true treatment for gender dysphoria is physical gender transition for the individual. In other words, the consensus is that it's ineffective and unethical to try and have somebody's internal gender identity match what's on the outside. So definitely the accepted method is to change the body to match the mind, not the mind to the body. And that's mainly because it's just been found that changing the body to match the mind is much more successful in actually lessening gender dysphoria than trying to change somebody's mind to match the sex that they were assigned at birth. It just tends to be ineffective and doesn't really work for most trans people. So for a lot of people, the first step that they may take in trying to treat their gender dysphoria is going to a therapist. And again, in some states, you are required for a gender dysphoria diagnosis. So a lot of people who are experiencing gender dysphoria may go see a therapist just as a means to fulfill those requirements and be able to go to the doctor and get that gender dysphoria diagnosis. But on top of that, going to a therapist for repeated sessions of therapy can help the trans people gain the tools that are necessary in order to cope with their gender dysphoria. So of course you can't necessarily cure it, but you can definitely learn tools and techniques that can help you lessen the effects of your gender dysphoria so we don't have outcomes like self-harm and suicidal ideation. So something that can also happen really at any point in somebody's journey is social transition. This is referring to the idea that without any medical intervention at all, you can decide to wear makeup, you can grow out your hair, you can dress effeminately, you can, or masculine, depending on if you're a trans man. But you can do all these things socially that help people perceive you the way that you want to be perceived without any medical intervention. A lot of people tend to socially transition before they've even started hormones, whereas some people may decide to be on hormones for up to a year or longer before they decide to socially transition. After going through therapy or getting that diagnosis of gender dysphoria from a medical professional, usually one of the first steps that people can take in medical transition is taking hormone replacement therapy. For trans men, this is really going to look like usually an injection of, or a gel of testosterone. So that's a supplement that acts as natural testosterone would in somebody who was born biologically male. So trans men will take that supplement. And then for trans women, the process is a little bit different. Estrogen can come in gels, patches, pills, and injections. I think I said all those correctly. But along with the estrogen injections or estrogen medication, a lot of people also take a testosterone suppressant. So that can be something like spironolactone or any other drug that suppresses the production of testosterone in the male body. So I definitely am going to talk about the effects of hormones and other medical procedures in a future video. I have one planned to talk about just medical transition in general, and so I'll definitely get into that in a later video if you're interested. But one thing that's really awesome about hormones is, first of all, the changes that they can have on your body. And also, according to Zucker, that same study from earlier, up to 80% of trans people, both trans men and trans women, experience lower levels of dysphoria after taking the hormones, which is a pretty staggering number. It's really exciting to see. While taking hormone replacement therapy can change your body in a lot of meaningful ways, some people, depending on their genetics or the age that they may start taking their hormone replacement therapy, they may not see all of the changes that they want to. And that's when a person can really decide to take like surgical intervention. And that could take the form of a breast removal, breast augmentation. It could be like more cosmetic surgeries for your face. So nose job, brow bone reduction. You can get chin implants. You can do so many things with your body. And I'd say one of the most talked about surgeries for trans people is the sex reassignment surgery. And that's the one that everybody thinks of when they think of just gender transition in general. And that's when they either turn a penis into a vagina or they turn somebody's vagina into a penis. And so those tend to be really like life-altering surgeries for people. And so yeah, that's definitely an option that people can have during their gender transition that tend to help reduce the level of dysphoria that they're experiencing. So the next thing I want to talk about is whether or not it's always obvious that a person may be experiencing gender dysphoria. And the big answer to this question is flat out no. I mentioned this in my last video, so if you haven't watched that video, that context may be relevant, but I talked about how my experience in coming out to myself was really a lot harder than coming out to anybody else. And so accepting the fact that I was experiencing gender dysphoria was really difficult for me and something that I struggled with internally for a really long time. And to say that it's always clear cut or that it's always obvious if a person is experiencing gender dysphoria is just flat out wrong, especially because of the differing severity levels that people can have. Also, in my last video, I mentioned the concept of imposter syndrome in the context of gender dysphoria and gender transition. And that is something I didn't expand on in that video, but I really want to take the time to expand on that now, because it is really fundamental for understanding why it may be so difficult for somebody to realize that they're experiencing gender dysphoria. So for anyone who doesn't know or isn't familiar with the idea of imposter syndrome, it's basically when you go into something and you feel like a fraud, or you feel like you're not supposed to be there, or you feel like you don't have the credentials that all the other people do that are around you, and so you couldn't possibly be in this group like the same way that other people are. A more common example of this would be like, say you recently graduate college, okay, and you don't have any solid work experience yet, but you land an interview for this job, you get this job, and the first day you get on this job and you're training, and everybody seems to know exactly what they're doing, and you're so lost, and you're starting to feel like, whoa, like I am a fraud, like I'm not supposed to be here. This group is way better than me. They know what they're doing, and I don't belong here. So that's kind of what imposter syndrome is, and a typical example of like what imposter syndrome may look like in other circumstances. But I really want to relate it back to gender transition and gender dysphoria. People that tend to be really susceptible to feeling imposter syndrome are usually the ones that have felt invalidated in their past, or they grew up in a family where these diverse trans identities were not accepted or talked about, or if you did experience any signs or symptoms, like your parents immediately shut it down, that type of stuff. So the issue is that when you're really early on in your transition, you may start to look to other trans people who are a lot farther along in their transition than you are. And so you can start to feel like they have all their stuff together and they have everything figured out. They're somehow getting the money for these surgeries and you're not. Why am I not? Is what I'm experiencing even gender dysphoria? Because these people tend to take like such initiative, and they like are already all the way through with their transition and this, but it's important to remember that everybody is starting at the same start line, but we're not all starting the race at the same time, right? There's a lot of trans YouTubers and just trans people in my life in general who I look up to a lot, and you can almost forget that they started somewhere too, right? If it's a trans woman, they started male presenting as well, and they just had more time to develop their own sense of identity and they become confident in that, and maybe you haven't yet. And the key word there is yet, because you likely will. If you're experiencing gender dysphoria, you likely will become more confident in your gender identity as time goes on. And it just feels like it's not the case. It feels like that's not the case for a while. The biggest thought that ran through my mind for a while was that I wasn't trans enough. And when you really break it down, it doesn't make any sense, because gender dysphoria itself is a spectrum of super severe to super mild. And there's no line that says, like, yeah, you're definitely experiencing severe gender dysphoria, or you're definitely experiencing moderate. Those are ways that we tend to conceptualize or categorize things, but that's not how actual reality works. And so you could be experiencing all these signs and symptoms of gender dysphoria and still invalidate yourself and tell yourself that you're not trans enough and that other people seem to be a lot more trans than you, or they're experiencing gender dysphoria a lot more strongly than you are, and so your case must be less valid. Well, that's not true. Again, gender dysphoria is a spectrum, and yeah. So as I mentioned, a couple things that can really help. First and foremost is just reminding yourself that everybody's journey starts at a different time and everybody's journey is going to look different. Comparison is the thief of joy, right? You can't compare yourself to other trans people, how they're doing, what they're doing. That's not going to be your journey. Your journey is not somebody else's, and somebody else's journey is not yours. Also know that even if you're not experiencing gender dysphoria to a super severe degree, you can still be experiencing a moderate or mild form of gender dysphoria that you still want to treat in some way with gender transition. And just because you're not experiencing these suicidal or self-harming thoughts doesn't mean that you don't have the right to transition, because at the end of the day, you can transition to whatever degree you want to. So obviously, those two things were more of a mindset shift than actually behavioral differences. So something behaviorally that you can do to try and overcome this imposter syndrome and try to feel more confident in yourself is to experiment and explore, whether that's in the privacy of your own home or if you're comfortable going out in public, right? Doing things, seeing what feels good and seeing what doesn't feel good is really the way to figure out if gender transition is right for you, and also if what you're experiencing is gender dysphoria. It's also the way to figure out how severe your case of gender dysphoria is you can tell based off your reactions to certain things that you may try that are new, that may be out of your comfort zone at first, but then you realize, like, oh, it actually does make me feel really good when I have longer hair, or it really does make me feel good when I wear this dress that fits my body just right. Those are the type of experiences that make you feel good and help you to feel more solidified in who you are. And that kind of leads me into my next point, which is just about gender euphoria, which I don't think is talked about enough to the general public. I think that trans people are pretty aware of what gender euphoria is, but I don't think that the average person understands the concept of what gender euphoria is. So gender euphoria is basically the opposite of gender dysphoria. So again, gender dysphoria is when you feel that incongruence with your desired gender and your biological sex. And gender euphoria really refers to the joy that a trans person may feel when they feel that congruence of the way that they're presenting themselves physically and their desired gender that they want to be. The Jessin 2021 article brought up a really good example of how gender euphoria can really reaffirm a person's identity, and it was in the section of the paper where they discuss sexuality and sexual impulses. They recount the story of a trans man who said that they felt like a man the first time that they ever kissed a woman, and that was a time that really reaffirmed for them that they felt like a man and that they knew they wanted to be a man because they knew that that felt right. So that's just one example of gender euphoria. But it can also be smaller things. Like I said, putting on makeup or putting on a dress that fits right. It can make you feel a certain joy, knowing that you're presenting in a way that you've always wanted to feel. For a trans person, it is likely that your largest source of gender euphoria is going to be when you counteract your largest source of gender dysphoria. So say that a trans woman is really dysphoric about the fact that she has a flat chest. You know, she's taken hormones and she hasn't quite gotten where she wants to be. Then if she decides to go get a breast augmentation and she now has very visible breasts, that would bring huge gender euphoria because now a major source of their gender dysphoria is eliminated or severely lessened. And like I mentioned, gender euphoria is really what guides you in your experimentation and exploration with different things. It helps you figure out the type of person that you want to be, because when you experiment and explore different things, you're going to find what makes you happy, and you're going to want to keep doing what makes you happy. And that's ultimately what forms your identity and how you present yourself. So my final point that I want to discuss is whether or not gender dysphoria ever goes away in a person's life. And the answer to that is complicated, but it's likely that gender dysphoria will never go away, but it rather would either shift forms or lessen to a point that it's kind of negligible in your everyday life. So Jamie, the YouTuber that I mentioned at the beginning of the video, brings up a really good point about gender dysphoria, and it's that at the beginning of your transition, gender dysphoria can feel all-consuming. It kind of takes up a lot of your life and a lot of your thinking because there's just so much about your body and about your presentation that you just really don't enjoy. And so before you've taken any steps in transition, you're going to see all these different aspects of your body, and it's all going to become a bit overwhelming. But then Jamie talks about how after taking hormones, a lot of the dysphoria was lessened because especially for trans men, those hormones can have a lot stronger effects a lot quicker. He talks about how taking those hormones and having more masculine presentation really did help lessen the gender dysphoria, but that didn't mean that it went away completely because there's going to be things that the hormones don't change. And so Jamie still did have to get surgery, top surgery to get breast removal. And they said that after that surgery, the gender dysphoria still remains, but it was lessened to a really far degree. And it was more targeted on certain specific body parts. So many trans men, along with Jamie, feel that something that brings them dysphoria is the fact that they may have curvier hips or like a smaller waist or smaller hands, stuff like that. And although it's not as severe as having a discomfort with your entire body, that gender dysphoria can still creep in every once in a while and tell yourself that these features are way too feminine and people are going to perceive you in a certain type of way. Even if it's not true or even if it's not rational, that's kind of why it's called gender dysphoria, because it's not always rational. You may see things in yourself that nobody else would ever notice, but that's just part of gender dysphoria. Unfortunately, there's no magical way to make a trans person cisgender. It just doesn't exist. We can't change our chromosomes as of right now, and there's really not much that we can do aside from taking steps in physical transition. But for that reason, I do think that there's probably always going to be small parts of gender dysphoria that remain no matter what you do with your body. So yeah, that's going to be all for this video. I know this was definitely a longer video, but like I said, I do think it's a really important topic, and I was definitely excited to talk about this one. And if I stick to the schedule that I have listed in front of me, my next video hopefully should come out next week. It'll likely be about misgendering and the heated topic of pronouns in general. So I hope that you all stay tuned for that, and I hope you enjoyed this video. If you're trans, again, I hope you related to some of the stuff I said or could resonate with some of it, and if you're not trans, I hope that you learned something new about gender dysphoria, because really that is the goal of this series, is to try and get people to learn the things that are important in trans people's lives and why trans people may think the way they do or make the decisions they do. And so, yeah, I'll see you next week.